She is a professor and exercise physiologist at the University of Victoria in the School of Exercise, Science, Physical, and Health Education, where she teaches courses in human anatomy, human physiology, and exercise physiology. She was a course director at the Island Medical Program since its inception in 2004 to 2017, and most recently was involved in the renewal of the UBC Medical Undergraduate Curriculum. Dr. Gaul has worked extensively at promoting the inclusion of exercise and nutrition into the medical curriculum at UBC as an active member of the Exercise is Medicine Canada, EIM, initiatives of the Canadian Society for Exercise Physiology, and has presented EIM workshops to healthcare professionals in BC. She is part of a team of colleagues across Canada focused on promoting practical strategies with the incorporation of exercise recommendations into primary health care. Dr. Gaul's research interests include the physiology of exercise ranging from elite sports to recreational activities, occupational and pediatric exercise physiology, and exercise intervention for those with suboptimal health. Please welcome Dr. Kathy Gaul.
Thank you. Thank you very much, Robert, and thank you everybody tonight for coming tonight. I appreciate the invitation to try to encourage you to be more physically active, because that's where my bias is. So usually when we do conference presentations, we have to identify if we have any biases. So right up front, I'm going to say, I'm biased. I think that exercise is medicine, and I think that everybody should find a way to fit some type of physical activity into their lives. And I hope that some of the things that we'll talk about today will help to encourage you to be more active or maintain your activity as you move away from here tonight. We're going to have a beautiful evening, so it might be a good thing to do afterwards. So, with that bias put aside, some of the things I'm going to talk about today include using androgen deprivation therapy to help deal with prostate cancer leads to some side effects. We're going to talk about some of the side effects and the implications that exercise has for managing those sorts of things. We're going to talk about bone health, which is not something that you not often hear about, especially in talks like this or talks around exercise in general. But for men dealing with prostate cancer, bone health becomes very important. So I'm going to link it to aging and physical activity, but also to ADT, or androgen deprivation therapy. We're going to talk a little bit about what an exercise prescription might look like and the effectiveness of a really good exercise prescription, and then maybe come up with a few suggestions and recommendations, and I'm happy to answer any questions that you might have. So something you probably already know, that prostate cancer is by far the most common cancer in men, and it leads to a pretty substantial issue with health and also cancer-related deaths. I don't want to emphasize that. What I want to emphasize is how we can find a way of enhancing the quality of the lives that you have. And to do that, we have to try to deal with the side effects of the treatments that you're facing. So there are many side effects to cancer treatments in general, and there are certainly side effects to the treatment associated with prostate cancer. And I don't know if you can see these very easily, but it's kind of small, but you can see fatigue, pain, some cardiovascular changes associated with the treatments that you're taking, some cognitive changes possibly, certainly endocrine changes. That becomes a big issue in prostate cancer. Your immune system can be impaired, some gastrointestinal issues might happen, and you can see I've just put a box around. These are the therapies that are most associated with prostate cancer. And you can see all the things that I've circled in the box over there are influenced by that kind of treatment. So we need to find a way of allowing you to use those treatments to deal with prostate cancer, but finding another strategy for reducing those secondary side effects. So I'm going to argue that exercise is going to be one of your best strategies for dealing with those side effects. So let me give you some examples of that. Androgen deprivation therapy. Now I recognize that not all men with prostate cancer will be on ADT, but a lot are. And even if you're not, the you have some similar effects where your testosterone levels are going to be really reduced because of the kind of treatment you have. Some of the side effects include a loss in muscle mass and therefore a loss in strength. So you go from having relatively nicely developed skeletal muscle, like you can see here with that bicep muscle, to something that has regressed or it's become a little bit smaller, or maybe a lot smaller. And the smaller muscle is, the less strong it is. With ADT, or with a reduction in your testosterone level, you also see an increase in your fat mass. Some of you may have experienced that already, some of you may not have. But ADT and a reduction in your testosterone levels really influences the way in which your body layers on fat or stores fat. So you can see that there can be a big increase in fat mass over time. You also see an altered insulin metabolism. Now, you may not be diabetic, but if you are following along an androgen deprivation therapy program, or you have a reduction in your androgen levels like testosterone, you will see a change in your insulin metabolism, which means that you see a change in the way in which your body manages your blood glucose levels. That means you are at risk of hyperinsulinemia, which leads you to, that's high levels of insulin, leads to the development of type 2 diabetes, leads to some other issues that are associated with this change in metabolism. Cardiovascular disease is another example of that. And that's the side effect of the treatment. In addition to that, if you don't have the androgens, like testosterone, available to you regularly in your bodies, then there's nothing helping to maintain your bone mass. And with the loss of bone mineral, you end up seeing the development of osteoporosis. Now, most people think that osteoporosis is a woman's disease, when in fact it's not. We see more of it in women than in men, but we see it in men as well, whether they are dealing with any kind of hormonal therapy or not. It just doesn't happen as often in men because men tend to be protected by a higher level of testosterone in their bodies. Now, in men where testosterone levels start to drop down, or if they're pushed down by some type of therapy, the risk of developing osteoporosis becomes quite high. That means the risk of fractures becomes high. Now, problem with fractures is that too excited about that. The increase in fractures leads to all sorts of changes in your ability to live a life with quality. So we're going to want to try to show you, I'm going to try to show you how being regularly physically active can help negate most of these changes. By being on ADT or by reducing your level of androgens in your body, all of these things reduce your quality of life. They reduce your ability to face the activities of daily living, let alone do something beyond just being able to get through the day. If that's the case, then you're going to reduce your ability to function generally, you increase your risk of other illnesses, and sadly, we also see an increase in anxiety, depression, and fatigue. This is a pretty sad picture that I'm painting here. That's about as sad as it gets. All the rest of today's talk is going to be happy, because you're going to see that we can negate this by applying medicine of exercise. So let's start with bone first, because personally I think that's the most important message to get to you, because it's something that you can have a big effect on by being physically active, and it's not that difficult to gain something, whether you are dealing with prostate cancer or not. We tend to ignore our bone thinking that it's always going to be strong, when in fact it changes over time, and it changes for all these reasons: age, alcohol excess, smoking, low calcium intake, lack of weight-bearing activities. That means lack of actually putting weight on your bones. That doesn't mean sitting. It means actually moving. And androgen therapy or androgen deprivation therapy, and that's why I have it bolded, because it's most relevant to you. So to do this, you really need to know a little bit of something about bone. So this is what bone looks like, and you can see that, see if I can get pointing here, there's a nice thick layer right here of compact bone, and then in the middle around here you can see that that's called trabecular bone, or cancellous bone. Sometimes it's called spongy bone. It looks spongy, but it's not soft. It's spongy because there's lots of little spaces between those trabeculae, or those spikes, but it's not soft. It's nice and hard. Bone is nice and hard. Now, this is the most scientific of the slides I have, and I don't want you to worry too much about this, apart from the fact that I want you to recognize that when bone is constantly forming. Even in our older ages, bone is constantly forming, maybe a little slower, but it's still forming, and that means it's being built up, and sections of it are being taken down and then rebuilt. So there's this rebuilding happening all the time. And the healthier your bones are, the better your body is at being able to manage that rebuilding. There's this balance between resorption, which is on this side, right here, where you have some old bone being removed, and the formation, which is on this side. Now, in androgen deprivation, it's this formation side that gets really slowed down. The resorption side continues on, but the formation side doesn't. And as a result, you start to see a loss in mineralization. The job that exercise has as a medicine for you is to help find a balance between this resorption, this breakdown, and this formation. So it helps to enhance that formation. Okay. The reason for that is that bone responds to bone responds to the stress that's placed on it. If you put stress on bone, it forms more bone. It becomes more mineralized. It becomes stronger. That's the reason why weight-bearing activity is so important. And in women, especially women that are postmenopausal, they're regularly encouraged to do weight-bearing activities to try to manage that bone loss. Well, that should be applied to everybody, not just postmenopausal women. And certainly it should be something that's encouraged in men who have something reducing their testosterone levels or their androgen levels. So if you are on ADT, then you really need to find a way to maintain your bone by putting some kind of stress on bone. And this diagram just shows you that on the far side, we have regular trabeculae. That was a spongy kind of bone. And you can see there's space in between there, and there's nice plates of bone that are all connected. And the weight on the side there, you can see normal bone trabecular architecture with an anvil, and the anvil's pretty big, and you can see that the structure holding it up has these nice borders to it that really help to manage that bone structure well. If you don't put that kind of stress on bone, then there's nothing managing or maintaining those structures, and they start to regress. That remodeling happens in a way that there's resorption, but there's no formation. So you can see that those trabeculae, like over here, there's a lot of space between these things. There's not a lot of strength that's going to be developed in here, and that's because there's less stress on the bone. So just having stress on bone helps to manage it. If you're in a situation where you don't have the hormones to support it, so to support bone mineralization, you need to try to encourage it all along a little bit more by putting some weight-bearing activity into your regular daily life. Osteoporosis just means porous bone. And the more porous the bone is, the less strong it's going to be. And the more porous it is, the less mineralized it is. And the less mineralized it is, the weaker it becomes. So if you aren't capable of managing that mineralization, because you don't have the hormonal support for it, and you don't put weight bearing in the mix as well, that bone strength is going to be dramatically reduced. So you have this mismatch between that resorption and that formation. And what exercise can do for you is it can help you add the weight bearing to it, the movement activity, the stress on bone, to help build that bone formation side of the equation back up. So this is what bone resorption looks like. You can see this is normal bone, and this is osteoporotic bone. A lot of spaces in there, and this is the real thing. This is normal bone, and this is osteoporotic bone. Which one do you want? As you can imagine, this is not going to be able to handle very much stress on it. So you want to try to maintain this nice structure of trabeculae or plates in the bone as well as you can. Just to give you another way of looking at it, these are the vertebral bodies in your back, and this is nice, healthy vertebral bodies, and this is osteoporotic vertebral bodies. You can see this vertebrae has collapsed. You can see that there's so much space between these trabecular plates. This is an osteoporotic set of vertebrae, not very strong. They don't handle stress very well. The reduction in bone mineralization and bone strength happens because of age. It doesn't have to happen only because of a therapy that you might be on. And sadly, this message doesn't get out to those who most need to know it, and that's the kids that are in their teen years, because that's the time. This is bone mass along here. That's the time in those teen years and early 20s where you get to lay down as much mineral as you could possibly lay down. After that, it's all downhill. Now, the rate at which it drops down can be modified a little bit, particularly by exercise, weight bearing, and nutrition. But it is also influenced by hormonal levels, activity levels, aging. You can see that here. Now, in this drawing, it has menopause in here because this represents what happens in normal aging women. And you can see the change that happens in age over time. And you can see that it quickly drops down in women, especially after menopause. But you have a similar thing happening in men. It just happens a little bit more slowly. Unless, for some reason, those androgens get dampened. So if you happen to be on androgen deprivation therapy, you're going to start going down this slippery hill very quickly. So the loss of bone becomes quite rapid. And the lower that mineralization goes, the greater the risk of fractures. Now, we can't, sadly, bring this back up. All we can do, even in any individual as we age, we can't bring it up in any substantial way, but what we can do is we can slow the drop-off. So the reason why we try to encourage everyone, not just those teenagers that I was talking about, but as we get into our middle-aged years and older, we try to encourage being regularly physically active with weight-bearing activities, is to slow that progression downwards as much as possible. And that's part of what you can do if you happen to be on androgen deprivation therapy to help to maintain your bone mineralization. You can do this by being as active with weight-bearing activities as possible. Let me explain how this happens. So I lied, I said that it was the only scientific diagram I have. This one's going to be scientific with a little bit of anatomy in here. Here's your brain, and this is a little gland that we have that sits at the base of our brain right in here, called the pituitary gland. The pituitary gland releases a whole bunch of hormones, and some of those hormones stimulate the testes, and they stimulate certain cells in the testes to release testosterone. So in somebody who's on androgen deprivation therapy, this gets knocked out. So the treatment that you're taking knocks out the hormones that are coming from this area, the hypothalamus, to tell the pituitary gland what to do. And as a result, certain of these hormones don't get released, which means that the testes don't produce testosterone anymore. Now, the challenge is that testosterone influences the formation of bone. So that means that in that balance, resorption keeps staying up, but formation doesn't. So formation drops off, which means you're going to start to lose bone. So we have this mismatch, or this loss of muscle mass, loss of bone mass, and an increase in fatigue. So hopefully we don't end up seeing something like this, but if the loss of muscle mass and the loss of bone mass continues, you will see this change in the skeleton as time progresses. Now, again, you might think of osteoporosis as being a women's problem, but we're talking about the loss of bone mineral density in a completely different way. So the effect of androgen deprivation therapy and the way it influences bone mineralization. This kind of loss, which has been identified as being something over 5% per year, maybe as high as 10% a year. Now the picture that I have here might be emphasizing this just a little much, but gives you an idea that it's quite a big loss per year. It is far greater than what we see in normal bone loss in women who are postmenopausal and are heading towards osteoporosis. In women, we're looking at 1 to 3% per year. In men that are on androgen deprivation therapy, we're looking at something like 5, 7, 10% per year. So it's a very big loss that happens very quickly. Why am I emphasizing this so much? Well, I'm emphasizing it because in those who are dealing with prostate cancer that have, as part of their therapy, androgen deprivation therapy, you can see this is cumulative fracture incidence. Those without with ADT are going to see this kind of increase in fracture, and those without ADT are going to have very little fracture. So if part of your treatment is ADT, you need to find a way to manage your bone loss. I mean, the easiest way of doing this, the cheapest way of doing this, the way that requires no prescription, no pharmacy, unlimited refills, is to be physically active. And that doesn't mean competing in a race. It doesn't mean finishing the Times Colonist, or it's now called Good Life 10K. It doesn't mean competing. It doesn't mean being in the gym with all the others who are covered in Lycra. It means just putting some weight on your bones regularly, daily, so that you can try to maintain this. Because it's not so much the loss of bone mineral that's important, but it's the effect of that. And this doesn't say loss of bone mineral, this says fracture incidence. And you don't want to deal with fractures. You want to avoid that. So the mechanical control here is that bone responds to stress. And it activates those cells that are associated with bone formation. They're called osteoblasts. If you want a name, they're called osteoblasts. They improve the mineralization, they improve skeletal strength, and that means exercise has the ability to do just this. So weight-bearing activity will allow you to manage those osteoblasts when you don't have the hormonal supports to do that. The weight-bearing can do that locally at the bone level as well. We know this for all sorts of reasons, but probably the best way of demonstrating it is what happens at the International Space Station. So that's a picture right there. That's a picture of Chris Hatfield. You know who Chris Hatfield is? He's coming here next week, right? He's going to be in Sydney. I'm going. Yeah. Can't wait. So there he is. He's running on the treadmill. That's called the Colbert treadmill. That's when he was at the International Space Station. We have David St. Jacques, who's up there right now, and he's doing exactly the same thing. This is an American astronaut as well. He's doing some resistance training. Really, really important for the astronauts to be doing this. They're up there for a very long time in almost zero gravity. And I'm sure you've seen the videos of them floating around, and it looks very cool, but without any kind of gravity, there's no stress on bone. And without any stress on bone, there's bone loss. Very significant bone loss. So the only way of managing that, the only way of helping to maintain their bone mass while they're up there for months on end, up to a year on end, is to put stress on bone. And so they do, they have a treadmill. In fact, the astronauts that are at the International Space Station have built into every day a time to exercise. And they use the treadmill and the resistance machine that's here. And if you look very closely, you can see that Commander Hatfield here has a harness on, and that harness attached to a set of bungee cords, and the bungee cords keeps him on the treadmill, and they can make it tighter or looser depending upon how much stress they want on their skeleton, and then the treadmill just goes, and they can actually stay on the treadmill, because otherwise without the bungee cords they just float away. So this keeps them on the treadmill, and the tighter it goes, the more stress there is on bone. And the same thing goes with using the resistance training system that they have as well. They do this every day in order to try to manage the loss of bone. Will they lose bone? Yep, they do. And when they come back, they have less bone than when they went up there. And can they regain it? Lots of questions around that. I won't go into that right here. We can talk about that later if you like. But it is something that we've learned through spaceflight research that is absolutely important to maintain the integrity of bone. Otherwise, they come back down here. They don't have the skeletal integrity to deal with the stress of gravity. So we've talked about this and the difference between osteoporotic bone and normal bone, but it's easy to think about that in weight-bearing bones, but what about non-weight-bearing bones? What about those in arms? This is bone, this is humerus, and an active arm and an inactive arm in the same person. Can you see the difference in the thickness of the bone in one of those? So this is one arm, and this is the other arm. And if you look really carefully, you can see that this bone, this part of the bone, is much thicker than this one, and this one is much thicker than that one. And this is the difference between the dominant arm and the non-dominant arm of a tennis player. So we get that with the use of muscle around the bone as well. So one more piece of evidence that I lie. I said there would be no more scientific slides. This one I don't want you to worry about what's on here either, other than to tell you that the mechanism that exercise has to deal with the progression of prostate cancer is far more than bone. Well, bone certainly plays a role in it, and I've emphasized this today because I think it's such an important message that you don't hear enough of. We also know that if you stimulate skeletal muscle, so if you ask skeletal muscle, those are the muscles that move your skeleton, so like your bicep muscle, or your quadricep muscle group, or any of the muscles that you can actually ask to contract, and they in turn will move your skeleton. If you ask those muscles to contract, when they contract, they release substances that stimulate things that happen in the rest of the body. Those substances enhance your immune system. And those substances also have a direct link to inflammation. And we know that one of the challenges with prostate cancer is an issue with inflammation. And the increase in these myokines that come from contracting skeletal muscle leads to a reduction in that inflammation. It also leads to a reduction in the vascularization of, or change in the vascularization to tumors. So we know that using exercise changes, you can see down here, changes tumor vascularization. Now, you might think, well, maybe I don't want to have more vascular, that's blood flow to a tumor, but the more blood flow you have to a tumor, the more you can direct the medication that's trying to reduce the tumor. And so a lot of work that's happening in a variety of different parts of the world, including here in Canada, is how we can use exercise to influence this. If we can deliver the cancer-related medication to the tumor more effectively, we may actually be able to have a greater effect with that treatment. So that becomes important as well. We know that regular muscle contraction and regular physical activity leads to a modification of certain genes. And that can also have a role to play in the development of certain types of tumors, including the prostate cancer. So there's a number of things that we know that regular activity can do to help delay the progression of prostate cancer in those who already have prostate cancer. There's more to exercise than just that, though. If we were to step away from just the prostate cancer situation and just think about the effect exercise has on general health, because those of you that are dealing with prostate cancer right now, you are far more than your diagnosis. And your life is far more than just that diagnosis. You have much left to do. You have lots of other systems in your body that you have to find a way to help maintain. So let's look at the general side of exercise. The benefits of exercise have been very well documented, and there's a lot of research that is ongoing in this area. For example, we can reduce the risk of dying of cardiovascular disease by about 50% by exercising regularly. That means exercising about 150 minutes a week. That's not many minutes per day. Maybe throwing in a couple of resistance training or weight-bearing activities in addition to that. We can reduce the risk of dying from diabetes by almost 60%, stroke by almost 50%, colon and breast cancer by up to 60%. We can even reduce the development of Alzheimer's disease by using regular physical activity. The very top line that I have right there says all-cause mortality, and all-cause mortality means for any reason you've died. Doesn't matter whether or not it's a disease, whether it's being run over by a bus, for whatever reason you have died, there is plenty of evidence to suggest that by regularly exercising, you can reduce your risk of dying for any reason by almost 50%. That alone should be enough to convince people to be physically active. Now, I mentioned at the very beginning in that really sad slide, that at the very end of that sad slide, it showed that if you had all these reductions in things, you might also see a development of anxiety or depression. We also know that regularly exercising has the same kind of effect on depression as some cognitive, or most cognitive behavioral therapies. That the effect of being physically active has the same kind of effect as medications that are often given for depression. So by being physically active in order to maintain your bone mass, you're also doing something for your muscle strength, you're also doing something for your cardiovascular system, you're also doing something for your mental health, your mood state. It actually is one medication that deals with all sorts of different symptoms, as opposed to taking a drug for every single symptom that you have. There aren't many medications that have the ability to do that. What I have on this side right here, this is Dr. Mike Evans. It actually says, "Hi, I'm Dr. Mike Evans." And Mike Evans is a family doc out of Toronto, who came up with this whiteboard video that's about 8 minutes long that talks about the importance of being regularly active in general for your general health. And I think I have time to show it. I wasn't able to show it last time, but I'd really like to introduce you to this. I think you'll find it very interesting. It's really well done. It's Canadian, which is great. And it's not written, or it's not developed for cancer. It's not specifically, it's certainly not produced for a prostate cancer group, but it is something that will help to demonstrate to you just how important it is to find a way to fit being regularly physically active into your daily lives. So it's certainly relevant to you, not because of the prostate cancer, but because you have all the rest of your systems that you're going to try to maintain. So I'm going to try to make this work. It worked before we started today, so let's see. Oh, it just might actually. Here we go.
Hi, Dr. Mike Evans, and welcome to this visual lecture I'm calling 23 and a half hours. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network, and I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category, but I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because all these things are sort of overlapping. But I picked up this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Postmenopausal woman who had 4 hours a week of the treatment had a 41% reduction in the risk of hip fracture. It reduced anxiety by 48% in a big meta-analysis. Patients suffering from depression, 30% were relieved with low dose, and that bumped to 47% as we increased the dose. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the #1 treatment of fatigue, and of course the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine, and what is 23 and a half hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, And so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour, and that if you can do that, you can realize all the benefits I described in the previous slide. So let's just take a quick walk through some of the literature. So Stephen Blair, he's a professor at the Arnold School of Public Health at the University of South Carolina, and he looked at this in what's called the aerobic center longitudinal study, which followed over 50,000 men and women over time. And along the left side of this graph is something called attributable fractions, which is kind of fancy word, but it's the estimate of the number of deaths in a population that would have been avoided if a specific risk factor had been erased. So for example, turning a smoker into a non-smoker, or a couch potato into a daily walker. And along the bottom is the typical risk factors. You can see the hypertension is incredibly important, and so on and so forth. But the one that was that kind of applied the most risk was this sort of mysterious CRF, which is cardiorespiratory fitness, which is really low fitness. So low fitness was the strongest predictor of death. And this is important that most of the trials we see, to be honest, are funded by pharma or other companies because they've got a drug for hypertension or high cholesterol or diabetes, and we rarely see fitness thrown into the mix, and so it's nice to see a trial that's not so siloed. Blair's work is interesting. He also did another trial looking at obesity. What he found was, sort of two things. One is obesity and no exercise. That's a very bad combination, and that's where we saw many of the negative consequences of obesity from a health point of view. But if the obese person was active, even if they didn't have the weight loss, but were just active and obese, that was much, much better, and that the exercise ameliorated much of the negative consequences of obesity. So if exercise is a medicine, what's the dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that the return is more granular. So if we took the Nurses' Health Study, women who went from zero activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise, so it can be broken into 3. Higher intensity, it looks like it's equivalent to less time with lower intensity. But I think obviously the clinical pearl is mostly thinking about your style and habits and your personal cues. So if you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve 158 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth. So thinking about that, I'm just going to walk you through some quick slices of the literature. The first one comes from Japan. In the 90s, Japan required all employers to conduct annual health screenings for their employees. And so a large gas company in Japan called Osaka used this to answer a great question. So if people's walk to work was longer, did that reduce their chance of serious health problems? So in this example, high blood pressure. And what they found is under 10-minute walk, no difference. 11 to 20-minute walk, 12% reduction in rates of high blood pressure or hypertension. And over 21-minute walk, a 29% decrease in rates of high blood pressure. So the authors calculated that for every increase of 10 minutes in your walk to work, there was a 12% reduction in the likelihood of getting high blood pressure. The second exhibit is looking at stents. So this is something we commonly do down medicine. So you can see on the left here, the artery is blocked. On the right, a vascular surgeon's gone in and put in a balloon, opened it up, and left a stent to keep it open, which makes great sense. So a German researcher named Rainer Hambrecht looked at this with about 100 cardiac patients. He got half the group to exercise, and by that I mean 20 minutes a day on an exercise bicycle, and then once weekly 60-minute aerobics class. And the other half got the high-tech stent and just their sort of normal activity. And after 1 year, 88% of the exercise were event-free compared to 70% of the people that got a stent. So both worked, but I find it, sort of incredible that the low tech made a bigger difference. And you have to remember that the stent just fixes one part of the heart. The next way to think about it is the reverse. So what I call sitting disease. We know that being sedentary is bad for your health, but a researcher named Leonard Veerman wanted to quantify this, and he did so down in Australia in a big study they did there. They found, compared with persons who watch no TV, those that spend a lifetime average of 6 hours a day watching TV can expect to live about 5 years left. I mean, that's incredible. But then I think, who watches 6 hours a day of TV? It turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something that's bad for our health, but clearly it's as powerful as many other risk factors for chronic disease. So I'm just going to leave you with, I guess, 2 quotes. So one is Jerry Garcia, the singer who was the lead singer for the Grateful Dead, and he said, somebody has to do something. It's just incredibly pathetic that it has to be us, and I think that's true, that in some ways it has to be us. As Hippocrates said, walking is man's best medicine. And so I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But my question to you is, can you limit your sitting and sleeping to just 23.5 hours a day? So, something to think about. Thank you very much.
Isn't that amazing? I don't know how I could add to that, but I'll try anyways. If you wanted to see that again, if you just Google 23.5 hours, it's the first one that comes up. It's been hit something like 8 or 9 million times. So it'll be the first thing that comes up. Just 23.5 hours. That's all you need to say. You don't have to remember Mike Kevin's name. Just 23.5 hours will do it. Great. So the reason why I chose to show you this, even though it doesn't have anything specifically to do with prostate cancer, is that it provides you with some additional evidence of just how important it is to just fit regular physical activity into your daily lives. It has an impact on your heart, it has an impact on your mental health, it has an impact on your respiratory system. Certainly it has an impact on other things as well, but it helps you reduce your risk of other challenges. You have enough challenges, you don't need to add anything more, so you need to take care of all the other parts of your body so that you can deal with the challenges that you have related to the treatment that you're doing. And once you're through the treatment and successful through that, you have lots left to do. So you need to make sure that you maintain what you have. As was pointed out before, we have lots of different parts of our body that are influenced by exercise. We have blood vessels and the vasculature. We have bone and joint health. We have the way the brain functions, the way muscles function. So similar to what I said before, this prescription exercise is a prescription for a medication that can affect all sorts of different parts of your body, not just one, unlike most pharmaceuticals. In the evidence talk, we talked exactly about this, the work that Stephen Blair has done that shows that low fitness, this is low cardiovascular fitness, has a greater impact on attributable fractions for all-cause mortality than anything else, even hypertension, obesity, smoking, high cholesterol, diabetes, you can see that. And he said that here. What I wanted to do is take those numbers and show you them in a slightly different way. And a colleague from UBC actually did this as a presentation a couple of years ago, and I thought it was just so impressive. If you were to take all of these and you could combine them together, at epidemic proportions, smoking, diabetes, and obesity are considered so serious, and yet physical inactivity or the low fitness level kills more people than those 3 things combined. So if we were to combine obesity, smoking, and diabetes all together, and we threw all of those on top of each other, it still wouldn't be as high as just being physically unfit. So now we hear lots about how important it is to become non-smokers or to not start smoking, because smoking has such a terrible impact on health, and it has a great risk factor for dying. And we've certainly hear lots about diabetes, and diabetes is a big problem that we have in our communities. And diabetes, without any doubt, has a big effect on mortality. And yet nowhere near the effect of being physically inactive or having a low fitness level. We don't hear about that. And there's lots that we know about the kinds of medications that you need to take to deal with diabetes. And we hear very little about the medications that we need to take to improve low fitness. That medication is being physically active. You don't have to take anything. You don't have to buy anything. You don't have to coordinate whether or not you're taking it at a certain time as another medication. There's no problem with combining it with other things. Exercise can be prescribed and used in a regular daily way for your whole life without any major challenges. Probably the biggest challenge to taking exercise as a medication is that it doesn't have an effect if you don't take it. It doesn't have an effect if you don't do it. And the effect that you get by using it as a medication is lost if you don't continue to do it. Not that different than any other medication. This is not anything new. We've known this for a very long time, and Evans reported that Hippocrates recognized this long ago, and his friend Plato, the same thing. We have known the importance of being physically active as a means of managing health for a very, very long time. So this is not new. It's just something that, for some reason, we've just forgotten about. So we need to come back to the fact that we can use regular physical activity to promote health, to preserve our health, to prevent disease, and also to manage our health when we do have health challenges. I referred to some guidelines a little while ago, and in fact you heard it on the video as well, that something about 150 minutes. Well, here in Canada we have these Canadian Physical Activity Guidelines that have been developed with some tremendously strong evidence behind them. And other parts of the world have looked at these and adopted them as their own guidelines as well. And the guidelines for adults, this says 18 to 64, but similar guidelines beyond 64 as well, is about 150 minutes of vigorous, moderate to vigorous physical activity. That means an intensity at which you can't actually sing anymore, but you can still talk. That would be the intensity. You've probably experienced that before. That's except for if you're swimming. That might be a better problem. But if you're walking and you can still sing to your heart's content, then you might want to just pick up the pace just a little bit. But if you're walking to the point where you can't talk anymore, back it off. You don't need to work that hard. So use the singing, talking cue for yourself. It doesn't have to be 150, in fact, it shouldn't be 115 minutes. And then do it once for the whole week. You should be spreading that across the whole week, so as many days as you can. And as long as it's in bouts of about 10 minutes at a time, that's good enough. And just add them all up over time. 10 minutes isn't very long. Now, if you happen to have parked in the parkade, it's probably going to take you 5 minutes to get there. If you happen to have parked maybe further down the street, you might have got 10 minutes in. And he referred to getting off at a bus stop earlier. Get on the bus stop further away from your house. Or here's another way. How many times have you circled the parking lot at the mall waiting for the spot closest to the door? When you could have parked far away, which is really not very far away, and then walked in. Oh, you might be in a rush, and sure, I get that. I do that all the time. But really, probably take more time just circling around waiting than it would be to just park far away and walk in and do what you need to do and then walk out. So there's lots of ways of building 10 extra minutes into your day a couple of times a day. Maybe 3 times a day, that would give you 30 minutes. And if you do that over about 5 days, let's see, 3 times a day, that's 30 times 5, that's 150. There you go. If you spread it across 7 days, which is even better, then you're going to get additional benefits for it. In addition, and especially associated with the group that we have here tonight, and the issue around bone, not only should you try to get 150 minutes as part of your exercise prescription of moderate to vigorous physical activity a week, but you also want to do some kind of muscle and bone strengthening activity. And there's lots of ways of doing that, and I can give you some examples of that. Oh yeah, by the way, the handle on your recliner does not qualify as an exercise machine. Exercise as management for men, with men on androgen deprivation therapy influences all these things that you experience. Fatigue, loss of strength, gain of fat mass, loss of lean muscle mass, loss of bone, loss of cardiovascular fitness, I've already said that part, and a change in your insulin control. This one medication of exercise influences all of those things, as opposed to taking some medication for bone loss, some medication for your cardiovascular system, something else for dealing with loss of insulin or change in insulin, something else to give you a little bit more management of fatigue. You don't want to be taking all those things. You got enough to take. You can replace all of those things, for the most part, with the help of your physician by using physical activity. So the prescription is 150 minutes per week. We know that it's safe. This is PCAP, that's patients with prostate cancer. We know this is a safe prescription for men who are dealing with prostate cancer, provided there are no other contraindications. So that means provided you don't have other health issues. So talk to your physician about this. We know the evidence shows us that it's safe. We know that it helps to preserve aerobic function, which means it helps to reduce that loss you have in cardiovascular fitness, which we saw was the highest bar in that set of bars that showed us attributable fractions to dying. We know that it influences insulin control. It improves your ability to control your blood glucose level. It reduces body fat. It counteracts the effects of ADT-related cardiovascular disease risks. It improves ADL, your activities of daily living, and it reduces fatigue. So that is specific to men with prostate cancer. We know also, related to prostate cancer, that resistance exercise, so that's muscle and bone strengthening activities, 2 or 3 times a week, are safe for men who have prostate cancer without contraindications. So again, talk to your doctor about this, but the evidence is very clear that it's safe to do, provided you don't have any contraindications. You can increase your muscle mass significantly, you can improve your strength and your balance. You want to maintain your balance. If you're going to be doing exercise, you want to be able to maintain your balance. It reduces fat mass, especially trunk fat mass, which is a big issue with men on ADT. It helps you to preserve bone, reduce that loss of bone. It helps reduce fatigue. People that I talk to or cancer patients that I talk to, not only prostate but other cancer patients, always say to me the worst part is the fatigue. And it's hard to get going when you're that tired, but in actual fact, the more active you are, the less fatigued you're going to be. The hard part is getting over that challenge of just feeling too tired to get started. But get up and move just a little bit, surprisingly reduces the fatigue. And there are an enormous number of studies that constantly demonstrate a reduction of fatigue with regular physical activity. Not a ton of activity, it can be in 10-minute bouts, but you will reduce your fatigue doing that. You will see some improvement in cardiovascular system, cardiovascular fitness, and most importantly, you'll preserve your physical performance, your ability to deal with the activities of daily life. So again, refusing to go to the gym is not the same as resistance training. Resistance training means you're going to be moving against some kind of resistance. For example, like bands. Have you seen the bands that are around? You don't need to be moving iron. You don't need to be pumping those great big machines. You can use your own body weight. You can use resistance bands to do the kinds of things you need to do in order to gain those improvements or reduce the effects of your treatment. This is probably an area of exercise prescription that is less followed. Most people think, oh, okay, 150 minutes, I have to get out for my walk, or I have to get out on a bike, or I have to do something. And they think about it aerobically, but don't forget the impact that muscle and bone strengthening activities have on the quality of life that you want to try to maintain or regain. here's evidence of this. These are bone cells, these are muscle cells inside a muscle, and this is what happens when you take muscle and you stimulate it with some kind of strength training. You can see the cells get bigger. This is what happens in androgen deprivation therapy in prostate cancer patients. This muscle and the muscle cells get smaller. So you lose that muscle mass. So you lose strength, because strength comes with the cross-sectional area of muscle. And the less cross-sectional area you have, as they become smaller, the less strength you have. But we know, and here's evidence of it, that if you use a strength training program in addition to androgen deprivation therapy, those prostate cancer patients will actually increase their muscle mass. So while the effect of the treatment, the androgen deprivation therapy treatment, reduces muscle size, the physical activity, the resistance training, enhances it. So you end up maybe not quite this big, but you still end up with some gain, or a better way of looking at it, less loss. And again, that doesn't mean to say that you need to be pumping big iron. You don't. You just need to be doing something that puts a challenge on muscle and on bone. So body weight activities, resistance band activities, they'll do it for you. So if we go back to the original slide that I had, we had this big increase in anxiety and depression and fatigue because we weren't able to do the activities of daily living, our quality of life's going down, our ability to function the way we're used to has gone down because we've lost muscle mass, we've lost strength, we've gained fat, our insulin metabolism is all wonky, and our ability to control our blood glucose has gone off the map, our bone density has gone down, we're osteoporotic, we're becoming at risk of fatigue. We saw that before. Well, let's apply exercise to it. Exercise is going to increase your muscle mass and increase your strength. It's going to allow for your insulin metabolism to remain the same. Your blood glucose control will be protected, certainly much more so than if you are not exercising. Your bone mineral density will be managed, at least to some extent you'll be able to manage that, and so your risk of osteoporosis goes down as well, or your risk of bone fracture goes down as well. That means that your ability to do activities of daily living are going to be maintained, are going to go up. Your quality of life will go up, your ability to deal with activities of daily living go up, you'll have less fatigue, you're reduced risk. And as a result, you don't have that depression or anxiety, or at least as much of it, you have this happy face. I know that's being a little bit spunky for me to say that, but the story really is that if you can maintain your activities of daily living and you can reduce your fatigue levels, then you're not going to have the same kind of level of depression or anxiety or fatigue as you would have if you're not doing anything physically active. So really, exercise is really good medicine. And that means regular exercise, doing it most days of the week. Maybe not 30 minutes in a day. Maybe it's only 10 minutes today. And maybe you can get to 12 minutes the next day, but do something because it can counteract the effects of the treatment that you're taking to deal with prostate cancer that you have. It helps to alleviate some of the changes in body composition, metabolism, and fatigue. And overall, it enhances your quality of life. This says, it can't see it, to treat your high blood pressure, diabetes, hyperlipidemia, osteoporosis, take this new pill every day. Take it out for a jog, then take it to the gym, then take it for a bike ride. Just take it. Do it every day. This is a prescription for medicine that has unlimited refills. But you can follow it. You don't have to have a pharmacist to give it to you. You don't have to pay for it. You just have to do it. So with that, I'll stop and answer any questions that you might have, but I hope I've helped to encourage you to find some way of building exercise into your lives. Thank you.
Does exercise compensate for blood loss?
Well, that's an interesting question. Does it compensate for blood loss? Regular physical activity increases certain hormones that stimulate blood formation. And depending upon how much blood loss you've had, you may not be able to compensate for all of it. but you certainly will be able to increase your hemoglobin levels and increase your plasma volume levels if you're exercising regularly. Yeah, the loss depends upon how much you lost. But absolutely, we certainly see an improvement in oxygen carrying capacity because with exercise, because regular exercise increases hemoglobin levels, so that's red blood cells. What's in red blood cells? Go ahead.
In the two tennis arms, what I'm wondering is whether the strengthening of the bone only works in bones that are actually being stressed. Like if I only work my upper body, do my legs build up at all, or is it just strictly?
Very good question. Yep, the stresses that are placed on bone will result in the bone that's facing that stress responding. The other bones will not.
So I won't get my skull thicker.
That's right. Yeah. Go ahead.
I just, at one time, I didn't like exercising. Didn't think it was not much fun. But I was working out with this guy, and he says, you can exercise way too much. He said, I used to do all this exercise. I went to my doctor, and he says, knock it off.
Mhm.
Cut it in half, and you'll feel better. And he thought the doctor was a quack. And like, where did you come up with that? And he said in 2 months, he was fantastic.
Well, there's certainly a lot of evidence for there being a negative impact on excessive exercise. There's no doubt about it. So very similar to any other medication that you take. If you take too much of anything, it's not necessarily a good thing. So too much
Yeah.
is it's a lot, but we definitely see some negative impact on the heart, for example, if you are exercising excessively. There are other areas as well, but the heart's a good example of that. And there is some very interesting research that's coming out of Vancouver, actually, on the impact that excessive aerobic exercise has on heart function. And it's surprising, but so those who have been running very long distances for a very long time are likely at greater risk of some cardiovascular issues than those who have done a whole lot less than that. But there's a balance there, and usually, like most things, excess is really excessive,
Yeah.
right? It's not, well, I did 12 minutes, it's excessive versus 10 minutes.
I'm not close to that.
Yeah, but there definitely is a point where too much of a good thing is no longer a good thing. And exercise is just like any other medication that way.
But with prostate cancer, they don't want you to take testosterone, even if they remove all the cancer, right?
That's right.
Because it could come back, or what?
Well, I'll leave that to your doctors to talk about, but
Yeah.
that's one of the challenges that you have, is that your testosterone levels are really low. So with a lower testosterone level, you see an increase in cardiovascular disease risk, you see a reduction in muscle mass, you see a reduction in bone. But if you apply exercise, especially weight-bearing exercise, you can still see increases in muscle mass. So while you don't have the testosterone level, you still get a muscle response. And you still get strength gains, because a lot of strength comes not only from the size of muscle, but also the neural innervation to that muscle. Your ability to control the way you recruit muscle. The better you are at recruiting muscle, the more coordinated you're going to be, the stronger you're going to be. So doing and using those muscles and using the nervous system to innervate those muscles helps you become more efficient in your movements and stronger. And we've already talked about bones. So you can see that there's impact on all of those structures in your body, even if you don't have the testosterone level there. And a classic example, a way of demonstrating that is, if you look at women, women don't have a very high testosterone level, and yet they can develop muscle. So you don't have to have high levels of testosterone to develop muscle. And I'm not suggesting that you turn into bodybuilders here. We're just talking about maintaining muscle mass so that you can maintain muscle function, so that you can regain regular function of your whole body and deal with the activities of daily living. And maybe a little beyond that. So you can get those responses even though your testosterone level is down. The exercise is not going to bring it back up. The exercise is going to allow those tissues to respond in ways similar to the way they would respond if the testosterone was there, but without the testosterone. Does that answer your question?
Yeah.
Great.
Excellent.
Great. I'll come back to you in a second. Go ahead.
I have a question regarding the testosterone. I'm often asked in the office if I exercise too much, will it increase my testosterone levels? And that's something I think a lot of people worry about in this setting, that increasing testosterone levels. Have you seen any
Well-
indication that exercise would?
Now, in men that are on androgen deprivation therapy, you're not going to get to testosterone because the whole hormonal cascade is dampened, so that's not going to happen. We produce testosterone, and produce testosterone not only in testes, but also in the adrenal glands. So there is some testosterone being produced. You can't get rid of all of it, but it will not increase very much.
I'm very, very active. My girlfriend thinks even though I swim like almost every day and I walk a lot and it's still working, that's not enough. She thinks that's not to go maybe.
That is not enough?
Yeah, she thinks it's not enough, that I have to go maybe. I don't think so. I swim like a lot.
So the swimming is going to be really good for your cardiovascular system, really good for your mobility, especially your shoulders, good for your back. It's not a very, doesn't have a lot of weight-bearing activity
No.
there. So you may want to add to your exercise regime something where you are weight-bearing.
Yeah, I also go to the gym a bit, but not near as much. It's mostly and
Do you walk to the pool?
I walk a lot.
Okay.
Like I probably walk, I think I do 150 minutes every day or more.
Wow, that's a
Like
lot.
all together.
Yeah, good.
Yeah.
And so are you worried that you're not doing enough
No,
exercise?
she's worried I'm not doing enough. I don't think so. I think my doctor's told me.
No, I said weight bearing. Weight bearing.
No, I
Yeah,
walk
so-
a lot too. And
Yeah.
I'm still working. I'm retired, but I still work, so very physical work too.
And so does that work require, because I work a lot too, but I
Up and down
tend to
ladders
sit,
and-
sit on a desk, which is yeah. So you're moving, so that, it sounds to me, the little bit that you told me here, it sounds to me that you've got weight-bearing activity, you've got some cardiovascular activity, you've got a bit of resistance or muscle and bone strengthening activities.
And
That's
I eat really good too.
And that's important because you can't be adding exercise to your daily routine without also managing your nutrition. Nutrition is equally as important. Yeah. You had a question?
Yeah,
I've been reading the book, Matthew Walker's book, Why We Sleep,
Oh, yes?
and he makes all the same pitches about sleep.
Yeah.
So what's the deal?
Well, all of that's a very good question, the importance of sleep. All the benefits that I've mentioned here with exercise will be much more available to you if you also build rest or sleep into your 24 hours. There's no doubt about it that sleep is important. Can there be too much sleep? Yeah, there can be. But if you don't have enough sleep, then your body is not capable of being able to take advantage of the challenges that have been placed on it. So if you're going to put exercise into your regular routine, you need to make sure you're getting enough sleep. It's absolutely critical to managing health. Yeah, and we're only just starting to learn about that. There's been a shockingly little bit done in the area of the importance of sleep. And the more we learn about it, the more we recognize that the link between a good exercise routine and sleep is very important. In fact, it's so important that a couple of years ago, the same group, Canadian Society for Exercise Physiology, that came out with the Canadian Guidelines for Physical Activity that I put up there, that same group came out with the 24-hour movement guidelines for children and youth. And those guidelines include sleep. So it's a 24-hour movement guideline, yet it still includes sleep. People kind of scratch their head and went, what? But in order to gain the benefits of being physically active, you have to have sleep. And it's very important in children and in adolescents, just as it's important in you. Yeah. So I'm glad you raised that. It's very important. Go ahead.
You mentioned the 10-minute minimum time for effective exercise. I've also come across a recommendation that for people who are very sedentary in their job, sitting at a computer, at a reception desk, whatever, that there's a very large benefit to just every half hour, every hour, just getting up, standing up, sitting down, just to break that cycle of being in one spot. Any comment on that, Kathy?
Yeah, sure. Sitting is the new smoking.
Okay.
That sitting for long periods of time has been demonstrated to have very significant negative impacts on the cardiovascular system, on the laying of fat in our body. It has some pretty significant effects on our health. So breaking up our day so that there's a little bit of movement in the day so you don't have long periods of sitting has, even if it's just for 5 minutes, just breaking the sitting routine down helps to enhance blood flow, it helps to activate muscle, it helps to activate the heart, it helps to change the way the body is functioning so that it's not going to be as negatively impacted by the sedentary part of sitting. Yeah. So it's better for you to break up those long hours of sitting by interspersing a few minutes of exercise within each one of those hours than it is to try to sit for, say, 8 or 10 hours and then get your 30 minutes in. The 30 minutes will not counteract the negative effect of the 8 or 10 hours of sitting. The 30 minutes will be useful, without any doubt, but they will not counteract the negative effect of the long sitting time. So you don't want to be sitting for long periods. Just like you have been here, been sitting for, I'm well aware of the fact that here I am saying, don't sit, and there you are sitting. Go ahead.
Does it make a difference between sitting up or laying down on a couch? I mean, neither of them are any good, but is one worse than the other? Laying down or sitting up, or does it matter?
Are you sleeping when you're lying down?
No.
Okay. Then I would say no, there probably isn't any difference.
About the same? Or?
The negative.
Oh,
Negative effects are probably equally as. Maybe sitting might be slightly better.
Slightly.
But I'm not going to say that out loud, although it's not recorded. Yeah, get up and stand up. One of the biggest challenges that we have now is that people don't watch TV, they watch Netflix. You can sit in front of Netflix for hours without moving. At least when you were watching TV, you had those 30 seconds to 1 minute periods of commercials where you could run to the fridge or run to the bathroom and get back in time before the commercial was over. But now we don't even have commercials.
I know a healthy way to watch Netflix. That's
Oh, there you go. On an exercise bike. Yeah, in front of the TV.
watch it all day.
Okay. I'm aware that you have a nutrition break and that you have other things to go on in the meeting, so I don't want to take up any more of your time. But if there's one more question, I'm happy to answer it. Otherwise, thank you very much for having me today.